Our lovely patient, who's 71 years old, is a month out from her deep plane facelift, and she comes in today in follow-up, and she's very graciously agreed to share some of her thoughts and feelings about what she was hoping to achieve and how her recovery is going so far.
Okay, well, I've had a wonderful experience with Dr. Clater and his staff. From the very beginning when I was evaluated and came in thinking that I would be eligible for a non-surgical procedure, and then found out that I wasn't at all, and that the deep plane facelift was really what was indicated. And so it took me a while to kind of come over to that idea, because I just never in my life ever considered having a facelift, having surgery. But I was really unhappy with how I was looking with, as my age increased and with time. And so I gave it thought and thought, well, this is the place to go if I decide to do this, which I did. And I had the testimony of my sister-in-law, who's absolutely beautiful, who's younger than me, but had a beautiful result. And so it was, and also some friends who were very supportive. They said, if you can have it done, why not have it done? Why would you not have it done? And I thought, well, she's right. Why not? So I've been very happy with the care from the pre-op time and during the surgery. The staff were all very attentive and, caring. And it just went very smoothly on my end, and came back the next day for removal of the bandage, which was helpful. And then just each week following up and feeling very positive throughout the whole experience. So I would encourage anybody, if you're thinking about it, to really give it some consideration, and highly recommend Dr. Clater and his practice here.
You're so wonderful. Those are beautiful, beautiful thoughts. Thank you. Mm-hmm. Share with everyone, and you touched on it a little bit, what the experience was like to have this operation under, I like to use the term tumescent anesthesia, but a lot of times people don't really understand what I'm saying when I say that. But what I'm saying is it's awake anesthesia. Right. Share with everybody what that experience was like.
The experience of the anesthesia was absolutely fine. I mean, the closest I can compare it to would be like having a colonoscopy, where you're not out, but you're not feeling anything, and before you know it, the procedure is over with. I was aware, minimally, because Dr. Clater on a couple of occasions asked me to change my head position, which I was able to do, but it wasn't like I was totally aware of, every minute of the procedure. It was over before I knew it, so.
That's awesome. I know you're only a month out, but have friends and family or even colleagues mentioned your results and how you look?
Yeah, my most recent experience with a couple that we are friends with, don't see them maybe more than once every few months, but Joe, our friend, was flabbergasted as far as how we look. Now, I have lost a little bit of weight, and so has my partner, Ken, but he, he's looking, wow, you look 20 years younger, so it was a great kind of validation of things. And then I've had other people that aren't aware that have commented that I'm looking great. So it's been very validating.
I love it. And for yourself, when you look in the mirror, do you feel that you look at all different?
Oh, yes, very much so. I had a saggy under the chin area and neck, and that was the thing that was most obvious to me, although there were a number of other things that were sagging too. But I definitely noticed that now. And so dealing with the swelling, it's slowly going down, and some of the little bumps and things, that's all kind of resolving over time, and I'm really very happy with it.
I love it. Well, the last question I always like to ask people is this something you would recommend to a friend?
Oh, absolutely. That I would recommend this highly to anyone who's thinking about it. Same same kind of concept of my friend who said, "Why wouldn't you do it? If you have a recommendation, if you have a surgeon, if you have Dr. Clater who's recommending it, and then why not? I think you should." So
I love it. Well, thank you for sharing your story.
you're welcome very much, and thank you for the wonderful work you've
Thank
done.
you. Thank you.